To describe delayed type hypersensitivity reactions, I would start by saying that they are very, very rare. I might see one every 3 or 4 months. And most of the time the client will report the dog or cat is depressed. This is much more common in dogs, by the way. But they'll report that the animal is depressed and seems hot. And when you see them, they are depressed, and the ears have a pinkish tint. If you kind of pick down to the skin, you can see the skin has kind of a pinkish tint. And you know, they're not eating, they don't feel very well. Sometimes they'll actually wince when you touch them. And the key element there is to, when you see a pet like that that's having what appears to be an allergic reaction to something, is to look at the record and see if they've had shots in the last 10 to 14 days. Delayed type hypersensitivity reactions aren't going to happen in the first 1 to 3 days after immunization. They'll show up deceptively late. And when I hear somebody describing an animal that's having just kind of this warm allergic response, especially in a younger dog, but can be any age, but a lot of times you're looking at a delayed type hypersensitivity reaction. When you see something like that, they're very easy to manage. If you suspect that's what's going on with a high fever, you can cover your bets with an antibiotic if you want. But if the history has vaccine in the last 10 to 14 days, then I don't even use an antibiotic at first. I'll usually give a corticosteroid and an antihistamine, because that helps faster. I'll use those 2 medications, and I'll have the client call me back the next day. If the pet is a lot better or even normal the next day, I don't worry about further diagnostics or other treatments or anything. We'll usually just follow through with oral corticosteroid, give it for a short course, 7 to 9 days tapering, and those pets do really, really well. There have been cases recently, though, that went very badly. There was one place that immunized. It was kind of a franchise veterinary practice, kind of a get them in, get them out veterinary practice. The veterinarian spoke English, mostly. 2 weeks after immunizations, the puppy got a fever, kind of turned pink, and was having trouble, and went back to the franchise vet. The problem was the franchise vet didn't want to admit that the dog was having a reaction to shots. So there was a kind of a political reason for trying other things. Not giving a steroid, not addressing it like a shot reaction because of liability issues, apparently. And if you think about it, franchises, they have really deep pockets, because you can sue the franchise deep bank account. Lawyers love it. Anyway, and some veterinarians don't want to admit that maybe they caused something. But my point being is that the puppy was doing poorly. They withheld steroids, antihistamines, used some antibiotics and tincture of thyme. The puppy deteriorated and started to show conjunctivitis, some aberrant behaviors, a tick, which is like a little jerking sort of behavior. So they referred to a specialty practice. And then when the dog went to the specialty practice, again, delayed type hypersensitivity was not considered, even though the puppy had received vaccines exactly 11 days earlier. And the funny thing is, when I read about that puppy, I asked the owner, I said, was your dog immunized 11 to 14 days ago? And she was like, yeah, I was. How did you know? It was immunized exactly 11 days ago. And I said, you should mention that to the referral specialist and see if you can get them to put a steroid on board. Well, it turns out that corticosteroids have kind of a bad reputation in diabetic dogs, and in dogs already being managed for Cushing's disease, and in dogs that are fighting infections. And so there's a lot of veterinarians, especially the really young ones, that aren't going to use steroids anymore. And the problem with that is, in that case, for example, with a delayed type hypersensitivity, especially if you're missing it, giving a steroid would result in really rapid recovery. But they didn't. The owner reached out to me again and said the dog is starting to show neurological symptoms. They're talking about a spinal tap. Finally, she reached out and said the puppy had died. It did not get the benefit of steroids. It did not get an antihistamine. Delayed type hypersensitivity was never considered. The specialty practice did an autopsy, or they call them necropsies, and sent the dog off to a university for a necropsy, and what they found was autoimmune meningitis from vaccine. It doesn't have to go that way. If you're on board pretty quick with just a little bit of steroid, little bit of antihistamine, and you jump on it pretty early based on the history and the fact that the puppy or the dog is pink, 10 to 14 days after immunizations, you certainly can try that. The veterinarians that would say, especially the young ones, who would say, no, if you give a steroid, you're going to create grounds for infection. Well, if you're really worried about that, just give an antibiotic. No, veterinary medicine isn't that simple, especially when you're a new vet. I remember when I was a new vet. You have no idea what prevalence is, so you know exactly how to treat more things than I know how to treat, except that you don't know if you're ever going to see one. Anyway, so I like steroids. I don't like delayed type hypersensitivity reactions, but they happen, and again, the pet turns pink, gets depressed, gets a fever, 10 days to 14 days after immunizations. Absolutely try a steroid, antihistamine, see how the results are in an hour, and then go from there. Good luck.